Welcome to the Augmentative Communication Consultation Service Introduction to Augmentative and Alternative Communication e-module. The goal of this e-learning module is to provide an introduction to augmentative and alternative communication to assist caregivers and local team members in understanding different types of communication strategies. Communication is about the exchange of messages between at least two partners. Without someone to receive the message, it is not effective communication. Language is more of a brain thing. It's what we understand and say. Receptive language is the ability to understand a message, while expressive language is the ability to convey a message. Speech is thought of as a muscle thing. It's the way we say things and how we say it. It is our articulation, voice, and fluency. Effective communicators use a variety of communication methods to express themselves. Communication methods include speech, vocalizations, body language, facial expressions, gestures, including both individual and conventional, pointing, real objects, photos, pictures, line drawings, symbols, and letters and words. We communicate for a variety of reasons, such as expressing ideas, acceptance or rejections, communicating a choice, greetings and closings, social etiquette routines, commenting, exchanging information, and requests to make our needs and wants known. Communication is all about strategies and opportunities. If there are no demands placed on the individual to communicate, if there are no incentives to communicate, if there are no opportunities to communicate, there will be no meaningful communication. An individual requires a reason to communicate, something to say, a way to communicate, someone to communicate with, and opportunities to communicate. AAC is an acronym for Augmentative and Alternative Communication. AAC consists of strategies and/or tools to help people with communication difficulties to communicate more effectively. Augmentative communication consists of a partial dependency on non-speech communication. Strategies and devices are used to supplement or add to verbal speech. Alternative communication consists of a total dependency on non-speech communication. Strategies and devices are used to replace verbal speech. People who use augmentative and alternative communication may use strategies or technology to help them to communicate more effectively. AAC helps people with complex communication needs to participate more fully in their social roles. This includes personal relationships, education, community activities, employment, volunteering, care management, etc. ACCS supports both augmentative and alternative communication and will assist in determining the best tools and strategies to meet your child's individual needs. AAC can include a range of communication strategies or tools such as no-tech, which includes gestures or signs and facial expressions, low-tech, such as pictures, symbols or icons, and simple speech-generating devices, and high-tech, which includes speech-generating devices and writing aids. No-tech means that there are no specific tools used, but instead strategies to communicate a message. We may use no-tech strategies naturally when we are speaking, such as gestures, pointing, or facial expressions. No-tech can also include using items in the environment to communicate our message, such as putting our shoes on to communicate the intent to go outside. Low-tech materials are books, displays, and simple non-computer-based communication devices with recordable messages. Low-tech can be used on its own or as a backup to a more complex high-tech tool. High-tech AAC tools are complex computer-based writing tools or speech-generating devices. A variety of devices are approved for prescription through the Assistive Devices program. Watch the ACCS Service Orientation e-module for more information about ADP. Your ACCS team will determine which tool is appropriate for your child based on his or her individual needs. AAC Myths. AAC will prevent further speech development. That is false. Studies have found that AAC does not impede speech development, but can actually encourage speech and language skills. Although AAC will not prevent further speech development, AAC intervention will not determine if or when a child will speak. There are prerequisites to using AAC. This is false. There are no prerequisites to using AAC. A clinical team will determine the best AAC tools and strategies for an individual by assessing his or her specific needs and skills. There are prerequisites to using a speech-generating device. This is both true and false. There are some prerequisites to using a speech-generating device. However, there are many misconceptions about what the prerequisites are. A child is not required to have a specific skill set to try a speech-generating device. However, in order to qualify for a device through ADP, the clinical team must be able to demonstrate that the tool benefits the individual. A speech-generating device may not work for every child. If a child does not qualify for a device when they try one, it does not eliminate the possibility of trying again in the future. A young child is not ready for AAC. This is false. There is no minimum age for AAC. AAC strategies and tools can be adapted and changed as the child grows and develops. Therefore, AAC can and should be started at any age. A child with severe cognitive deficits cannot learn to use an AAC system. False. An AAC system is chosen for a child based on his or her abilities. Any child can learn to use an AAC system. Success lies in choosing a system that best fits the individual's needs and abilities. AAC makes a child look abnormal. This is false. The ability to communicate effectively, no matter what the method, allows a child to participate fully. AAC can allow a child to demonstrate his or her abilities, share ideas, develop relationships, and engage with others. There's nothing abnormal about that. Thank you for watching the ACCS Introduction to AAC e-module. Please refer to the following resources for additional information and support.